I'll call the City Council public hearing of July 20th, 2021 to order at noon. Roll call, please.
Mayor Copeland,
Here.
Tom Baylor is absent. Kathy Sherman,
Here.
Jeff Guard,
Here.
Melina Meyer,
Here.
Ann Schaefer,
Here.
David Allison,
Here.
and David Gleason.
Here.
That's a quorum of council.
Okay, thank you. Today's public hearing is Emergency Ordinance 1199, an emergency ordinance of the Council of the City of Cordova, Alaska, amending the city COVID-19 Health Advisory Plan to update the community outbreak rules in Appendix C of the plan to provide the city flexibility in mitigating COVID-19 local outbreaks in light of vaccine accessibility and medical advancements. Would anybody like to speak to this public hearing item? Okay, seeing none, we'll stand in recess. Where's that? Kathy, I have to leave him.
Sure. Okay.
Well, I'm projecting 4 million kilowatt hours of sales for July, and that would be about the 7th time in history, so.
Because of the processors. There's a lot of pinks.
Yeah.
You could probably load your boat with pinks if you wanted to outside Strawberry.
Oh, they're coming in through the cutoff?
Yeah, they're coming in on the flats, and
Well, they always do.
Yeah, they come in through Strawberry and then go through the cutoff.
Pipes and things.
Some of them will filter on up the inlet, but a lot of
update the community outbreak rules in Appendix C of the Health Advisory Plan to provide flexibility in mitigating COVID-19 outbreaks in light of vaccine accessibility and medical advancements.
Are we back in or are we still recessed?
How did they fix the black cod in Maine?
In a meso Okay, so one last bite at the public hearing. For anyone who'd like to testify on emergency ordinance 1199, an emergency ordinance of the Council of the City of Cordova, Alaska, amending the city COVID-19 health advisory plan to update the community outbreak rules in Appendix C of the plan to provide the city flexibility in mitigating COVID-19 local outbreaks in light of vaccine accessibility and medical advancements. Anyone like to speak to that public hearing? Okay, seeing none, the public hearing's adjourned. I'll call the special city council meeting on July 20th, 2021 to order at 12:15. A roll call, please.
Mayor Copeland,
Here.
Tom Baylor is absent. Kathy Sherman. Here. Jeff Guard,
Here.
Melina Meyer,
Here.
Ann Schaefer,
Here.
David Allison.
Here.
And David Gleason.
Here.
That's a quorum of council.
Move to approve the agenda.
Second.
Motion and second to approve the agenda. Any modifications? Seeing none, the agenda is approved as submitted. And we have guest speakers. And I'm pleased to welcome Dr. Zink, our State of Alaska's Chief Medical Officer, back to speak with City Council. Greatly appreciate her support throughout the pandemic and willingness and availability to call into Cordova and support us. So thank you very much, Dr. Zink, and I'll turn the mic over to you.
Great, thank you so much. I hope you can hear me at this point, but I just really wanted to thank all of you all. It's been a journey. It's been 18 months now. I remember when you had your very first piece over a year ago. Here we are a year later. While we're all done with COVID, COVID, unfortunately, is not done with us. So I'm sorry that you guys are experiencing another set of cases and appreciate the incredible partnership with you all in trying to keep your community healthy and safe and be able to get through this current surge as well. We are seeing this nationally, so we've had a 70% increase in cases across the country with a 36% increase in hospitalizations, all based on pretty much a really rapid rise in the Delta variant. People have really let down, a lot of their COVID mitigation practices, and many times for good reason, as we need to see family and friends and travel and do the things that are important to our economy, to our business, to our loved ones overall. But unfortunately, the Delta variant is taking advantage of that at the moment. We do have a report coming out from the state right now that we are seeing a significant increase in the Delta variant in Alaska. Our report today will show that 80% of our sequence cases on our most recent run are Delta variant, and we're seeing Delta variant in most of our communities across the state. So we suspect that these large outbreaks really across the state right now are the Delta variant. The good thing is the vaccines appear to continue to hold up well against the Delta variant, not quite as well as the wild type, so somewhere between 80, 85, 88% effectiveness against the Delta variant for any symptomatic disease, and more into the mid-90s against any asymptomatic disease. Unfortunately, we're starting to see more a tale of two pandemics, the fact that unvaccinated continue to make up the majority of our hospitalizations and deaths. 96% of our hospitalizations and 98% of our deaths are in unvaccinated individuals. And so continue to try to message about the importance of vaccination. That continues to be primarily adults. Again, this disease does not appear to affect kids as severely as adults. It's not 100% benign, and kids unfortunately have been infected other ways, be it lack of school or family or friends, and all the ways that our kids have really been challenged throughout the past year. But as far as the disease goes, it does not appear to affect them to the same degree that it affects adults. Currently, 44% of the hospitalizations nationwide are in people less than 40, however, and that's primarily because that's the group that is not vaccinated. Really wanted to make sure that we're providing communities with transparent real-time data, including information about vaccines. We are always happy to provide a science echo, come to the community and meet with people and talk about what we're seeing, what we're hearing, what we know about this variant or others. This time there's no recommendation for a booster shot, and the normal mitigation efforts still work against the Delta variant. So distancing works, masking works, outside is much safer than inside. And for particularly high-risk individuals, considering reinstituting some of those mitigation practices, such as masking, even if they're vaccinated, can be a useful tool because not everyone's immune system is exactly the same. And we have had, cases of vaccine breakthroughs, not 100%, and so want to make sure that Alaskans have the tools to protect themselves. The last thing I want to say is testing. We talked a lot about testing at the beginning. You guys were just so impressive at your ability to partner together to be able to provide, testing throughout the Cordova to make sure it's accessible. And I'll never forget touring and seeing all the lab machines lined up and how you're getting paperwork and everything else done. Those are really continue to be the flashlight on this disease. There's no real summer cold going around. We've looked for RSV, influenza, adenovirus. The summer cold that's going around, a lot of it's COVID. And so if anyone's symptomatic, really, really encouraging them to get tested because knowledge is power, and that allows you to make sure that you don't accidentally spread it to others, particularly with a variant that is 2 to 3 times more transmissible than the wild type, so that R0 value is much higher. So happy to take any questions, answer any questions. I really wish it was there in person because you guys live in the most beautiful spot, and love the partnership that you guys have, but I'm honored to come to the city council meeting today, and again, I'm here to support you in any way we can.
Questions, council? Dr. Zink, are you seeing cases of reinfection with the Delta variant for those who've already had and recovered COVID earlier?
Yeah, that's a great question. We are seeing cases of Delta variant in reinfection, people who have previously been recovered from COVID. People clearly get some degree of protection from natural infection, but it appears to be very variable depending on the severity of your illness, your age, and a couple other factors. In general, the more sick someone is, like the higher their antibody levels were compared to someone who is mildly symptomatic, they tend to have lower ones. Some studies out of the UK showed that against the Delta variant, natural wild type infection was about 30% effective against the Delta variant compared to the wild type, where you were getting more like 60%. And again, vaccines, you're getting more up to like 80, 85%. So we're seeing more reinfections with the Delta variant than we were with the wild type.
Thank you. Councilman Guard.
Yeah, hello. One of my concerns in this is with the big uptick we're seeing in infection rates around the world. How much more likely are we to be seeing more variants that may be more problematic than the ones we're dealing with now? I mean, infection rates are going up, and the more infection you have, the more variants you get. So what are some of the thoughts on that?
Yeah, Councilman, it's a great question and a humbling and sometimes overwhelming one thinking about it. You're exactly right. We're watching evolution and progress. We're watching this virus change as each of us works as a potential incubator. This virus cannot replicate without us as humans, as a host to do that. And with the billions of people that we have around the world and how many people are working as an incubator, we are going to have just higher and higher likelihood that the virus will continue to change. It's for these reasons that we continue to really try to do everything we can to slow it down, because the more dead ends that this virus hits, the less chances it has to use our body to replicate and continue to change in a way that is either more transmissible, more lethal, avoid some of our treatment options like monoclonal antibodies, or avoid protective factors like the vaccines. We have already had to change our monoclonal antibody treatment because the way that the virus has shifted and changed that against these new variants, the old monoclonal antibodies don't work as well. And so we've had to switch to a new monoclonal antibody for treatment aspects. So you make a great point, and I think it's important to think about that even in context of the 1918 pandemic and how many more people we have worldwide and how many more people we have moving worldwide than when we've had other previous big pandemics that just puts us all at higher risk, and why it's important that we continue to try to vaccinate everyone as quickly as possible.
Thank you.
Other questions, council? Councilman Meyer.
Yeah, thank you, Dr. Zink, for calling in today. From my understanding that this new Delta variant, the viral load is a lot higher than the original strain, and that's why just why it's being transmitted so much. And we've had a couple, seems like, that have been tested positive that are fully vaccinated. So there is a lot of concern whether vaccine works, whether they should get it, whether there's a higher risk because our community has so many positive cases right now. Is there anything that you can speak to that on about whether masking or what the vaccine can provide for them?
Yeah, Councilman Meyer, thank you for that question. A couple different comments about that. So first of all, there is some initial data that shows the virus that replicates more quickly, and there's more virus in the upper airway, which may be one of the reasons it may be more transmissible. It does also have a change in the spike protein, so it may also enter the cells more easily. There's variable data if it makes people sicker or not. So data out of Scotland showed that it did. Data out of Israel shows that it's about the same. So I don't think we have a clear understanding if it makes people sicker if they get it. But from a population standpoint, the more people that get the virus, the more people we end up seeing sick, hospitalized, and dying. So transmissibility matters more from a population standpoint than even lethality. If a disease is very highly lethal and it causes it's awful for that one person, but it's harder to spread. A disease that's highly contagious ultimately kills more people, hospitalizes more people because it spreads to so many people so quickly. We are getting tons of questions about how well does the vaccine work or doesn't, and I think that there are really two factors that play into the chance of you getting COVID. And the first is if there's COVID in your community. If there's no COVID in your community, vaccinated or not, you're not going to get COVID. The second is if you're vaccinated. And so what we continue to see is, like you guys are experiencing, when COVID starts to circulate in the community, you see both vaccinated and unvaccinated people getting COVID. However, when you look at the denominator, how many people were vaccinated compared to unvaccinated, it's gigantically different on the chance of getting COVID if you're vaccinated versus not. So currently 4.2% of all of our cases are in vaccinated individuals. So it's not zero. I mean, it's still hundreds of people, but it's 4.2%. Same with hospitalizations and deaths. So again, 98% of our deaths are in unvaccinated people. But unfortunately, we have lost a couple people who've been fully vaccinated who have gotten severely ill. They had significant comorbidities, but we still lost some people who were fully vaccinated. And then again, hospitalizations the same rate. It's for those reasons that we continue to message about thinking about non-pharmaceutical interventions like masking, distancing, keeping your bubble small, making sure your health is well taken care of, particularly if you're someone who has underlying health conditions. Number one thing we recommend is vaccination. And if you can't get vaccinated and or you have other health conditions and you're in a community with a lot of rates of transmission, considering adding additional tools. So when we went back to the red kind of alert level, I was like, okay, mask is going back on to the grocery store and other things that I do. Even though I'm vaccinated, even though it says, CDC says you can wear it the rest of it, I know that there's a chance that I could be a breakthrough case. And I just really don't want to. And so I am making that choice to, as we've got a lot of COVID spreading, just taking one additional step to mitigate the spread in case I get it or in case other people get it. But the best thing I can do or any of us can do is get vaccinated. Does that answer your question, Councilman?
Yeah, and I do just have one follow-up question. Even though we're still in the summer and we can't predict what fall is going to be like, there are some conferences, meetings, events that are historically planned for the fall time. And this year, I think a lot of people were hoping that we were going to be able to host those in person in Cordova. How do you feel about indoor gatherings, events, conferences, and can they be done in a safe manner? Even if Cordova has a high vaccination rate or if we get this current outbreak under control, what are your thoughts on those type of activities and also school?
Yeah, it's a great question. I'm looking at my schedule for August, September, and October and thinking about what that all means, as well as conferences that we're hosting or in person. There, again, are speed bumps that we can use to slow this down. And I think that thinking about if an in-person gathering is important, like, for example, schools. I mean, it's critically important our kids are in school to learn. They have lost a lot of time. They have had a lot of challenges this past year, and the data is clear that in-person schooling, kids in general do much better than doing remotely. So whatever we can do, but that doesn't mean that we just ignore that COVID exists. We layer it on with additional protective measures to think about what that looks like. So things like surveillance testing. So if, for example, a conference with a bunch of state health officials with the current surge, now it's like you need to be tested plus vaccinated to be able to come to it as an additional tool that they're saying to try to mitigate the chance there will be, an event where a COVID could spread. doing surveillance testing in the schools, and it can either be pooled testing, surface testing, weekly testing, antigen testing. There's a lot of different testing options to be able to try to mitigate the case. You know, Florida, for example, was in person the entire year last year with a lot of cases. They did impressively well at keeping kids in school and healthy without a lot of cases in school, and they really did it by two things. They had access to testing with a less than 24-hour turnaround time for all of their students, and they started to do surveillance testing, and they were masking. And those two things really kept them in school. I think we all are in agreement that kids learn best in person, and we would really like that. We'd like to have businesses open and communities gather and events happening. But unfortunately, we still have COVID, and so just like we wear a seatbelt when we drive down the road, like we just need to take some precautions to make sure that our events or our schools aren't making people sick, particularly in large numbers, and so using those tools. The current CDC guidance regarding schools really have a whole list of options to try to choose based on your community transmission rate. What does that community prioritize, not prioritize, access to testing, things like that, to try to give schools a series of options to keep kids and schools and communities healthy.
Thank you.
Helen.
Hi, Dr. Standers. I had a constituent, Dr. Zink, have a constituent just ask a question. If it's worth getting other vaccines, like if you have Moderna, should you get Pfizer too, or should you get a third shot? What's the science saying?
It's a great question, and I'm always honored to be confused with Dr. Sanders, so thank you for that. Regarding a third shot, at this time, the data is not showing that we need a third shot. So it is showing that we're holding with good immunity. So if you got your 2 shots of Moderna, at this time, there's no evidence that's significantly waning. There is a meeting this week with the ACIP to look at more of that data. So that is a constant point of review and a constant point of questioning. The one exception to that is there is some initial data in solid organ transplant patients. People who've had a liver transplant, a kidney transplant, that a third dose may help to increase their antibody levels overall. Currently, a third dose is outside of the FDA regulations for the EUA. The big difference between an emergency use authorization and a full authorization is if you can use it outside of the emergency use authorization. So once something's fully authorized, then it's not against the actual authorization to give, let's say, a third dose. But while it's in the EUA, it would be outside of the authorization to give a third dose. So the FDA and CDC are reviewing that literature currently. So for now, we are ready and prepared with vaccines if a third dose is needed or recommended, but we don't have the data to suggest that it is, and we're not seeing currently the vaccine breakthrough cases because of waning immunity. Again, 4.2% of all of our cases are vaccine breakthrough, people fully vaccinated and then got COVID, which is about what we would expect based on the vaccine efficacy. So at this point, we're not seeing that change, but that could change at any time, and we'll continue to follow that and stand prepared to offer it. My guess, if we do a third dose or if there's a recommendation, it will be for a limited subset of the population, potentially people who are immunocompromised, older, or potentially healthcare workers, rather than a broad general public. This looks like it works much better and much longer than, like, say, the flu vaccine.
This is Councilman Schaefer.
Councilman Schaefer.
Hi, yes, Dr. Zink, thanks so much for coming and speaking with us today. I'm just wondering what else we can do as a community or as individuals to encourage our non-vaccinated contacts to get vaccinated. At this point in Cordova, vaccines have been available for a long time and have been widely available. So it feels like people who aren't vaccinated and that can be, are actively choosing not to participate. I'm just wondering what the best goals moving forward are to encourage vaccinations among that population.
Yeah, it's a great question that we continue to ask and refine and to change. I think people have really good and very important questions about vaccination, and want to continue to make sure that their questions are heard and that they're asked. We are happy to provide information if that is helpful at all. I would highly encourage communities to consider having our Speakers Bureau come do this town hall series of questions. You know, be it a church or a PTA group or a coffee club, it doesn't matter. It can be a group of 10 or it can be a group of 50. We are happy to meet via Zoom. We have a whole series of healthcare providers who are donating their time and happy to answer questions. But our experience has been that many people have very valid questions and concerns about the vaccine, and by being able to talk through everything from what's in them and how long does it last in your body, and is this going to cause fertility problems, and how do we know about long-term side effects, and why is it not FDA approved, and how about the VAERS data, and aren't people dying from it? I mean, these are questions that we get all day, every day, and they're important, and they're good questions to be asking. And so I think just encouraging people to ask the questions from a trusted source, talking to their healthcare provider. 96% of healthcare providers are vaccinated, physicians are vaccinated, and I think that speaks to, you know, kind of looking at the data and what we see with COVID. So I think encouraging questions, we are so much stronger together. So I think not placing blame, judgment, pressure on people who are choosing not to get vaccinated. It is a personal choice, but providing an open forum and dialogue to have a robust conversation and access to as much data and information as possible, so that we can collectively move past the pandemic together.
Thank you.
And if there's anything that we can provide, if there's anything you know your community better than we ever will. So, you know, I was recently in Uthiavik, and I got so many questions about what's in the vaccine. And they were like, can you please just do a handout on that? I was like, sure, no problem, we can do that. So if there's anything that you feel like your community would benefit from, information about long COVID, information about vaccine, anything, we're happy to partner with you all to try to get that information out and to answer questions.
Further questions, council? Okay, yes, Councilman Schaefer.
Sorry, just one more. Do you have any idea as to when the vaccines might be available for the under 12 population?
Yeah, another great question. So the current studies on the 2 to 12-year-old or 2 to 11-year-old has been submitted to the FDA for the Pfizer. They've been finished enrollment for their studies, and they're submitting it as they go to the FDA. Part of it is they need to have enough kids exposed to really look at the efficacy data of it. Initially, that was going slowly because we didn't have a lot of COVID cases in the country. Unfortunately, those are going faster now because we're getting more and more cases in the country, so that is going to speed up just those studies because it will show more people, give us a better sense of the efficacy data. That all being said, I suspect late fall, early winter-ish time is when we're thinking that we will have those studies complete, get reported to the FDA, and fully reviewed for the 2 to 11-year-olds. So I think it, unfortunately, will be after school starts, but hopefully before 2022.
Okay, further questions, council? Okay, well, thank you, Dr. Zink. As always, appreciate your support and calling in for this special meeting as we move forward.
Thank you all, and thank you for your service to the council and to Cordova and allowing me to come join for a few minutes today. Always happy to come back.
Okay, we'll move to Dr. Sanders.
Hi, council members. I'm here just to provide a little bit of information on the cases, the current situation here in Cordova. I think, as you all know, this morning we have 70 active cases. Approximately half of those are in congregate housing in the seafood industry, and 14 of those individuals are vaccinated. I think one thing that's interesting about our cases that we're seeing here, because a lot of our cases are coming from congregate settings, we are doing a large number of surveillance screenings to vaccinated individuals with very, very mild symptoms are still getting tested. And I think that is part of the reason that we have a high number of vaccine breakthrough cases. I am here to answer any questions and be part of the discussion today.
And Dr. Sanders, did you say 60 active cases?
70.
Okay, great, thank you. Oh, you're coming in very clearly, but just that one number I didn't hear well, so appreciate that. Council, questions? Councilman Guard.
So how many different congregate housing setups with the seafood workers do we have this showing up in? Is it multiples or just one congregate setup?
No, it's multiple. It's multiple different setups. It's not just one large dormitory outbreak.
Thank you.
Mm-hmm.
Not good.
Councilman Meyer?
Yeah, so because we have a high case count right now, and it sounds like it's in the seafood industry and in the community, is it wise for the next community testing for most individuals, vaccinated or unvaccinated, to go get tested just to get the initial kind of screening?
We're still recommending the same criteria for testing. So asymptomatic vaccinated individuals. So if you're vaccinated and you're not having any symptoms, we're not recommending screening tests for those individuals. We're continuing to do the travel screening, any close contact screening. We are doing those tests, and anybody with symptoms, we want them to come and get tested. We are doing testing 6 days a week. You can call the hospital or a Lonca clinic if you're having symptoms. We can get you tested pretty much immediately with rapid results. We are also holding open community testing. It varies from week to week when we do this. This week we're offering it tomorrow starting at 10 o'clock at the hospital ambulance bay.
Councilman Gleason?
Yeah, Dr. Sanders, I was just curious, those 14 vaccinated individuals that test positive, are they all mild symptoms or do some of them not have symptoms?
I think from a healthcare provider's perspective, when we see them, it is significantly more mild than what we see on average with unvaccinated. From what I've heard some people describe it as similar to their second shot for the vaccine, that their symptoms will have headache, fever, and feel ill for 2 or 3 days. But certainly when you're used to feeling healthy, that can feel very significant. But so far, and this of course could change, so far here locally, we have not seen anybody with the more prolonged severe illness needing to come into our hospital that's vaccinated.
Okay, thanks.
Councilman Meyer?
Another kind of follow-up question. We kind of have been asking questions about vaccinated and unvaccinated. Is there any kind of information you could give us on people that have had COVID in the past, like of these 70 cases of unvaccinated, vaccinated? Do you know if any of them had COVID or if that matters necessarily in the affection that we're seeing here locally?
At this point, we haven't identified any of those cases. I think all of us are interested in those effects in our vaccinated people, how sick they're getting when they get COVID, and people that have previously had COVID, that natural immunity, what does that look like? Should those people still get vaccinated? And as you all heard Dr. Zink talk about the kind of 30% efficacy from natural immunity after you've had illness, we absolutely do advise anybody that has had COVID to come and get vaccinated. Nationwide, we are seeing that. Here, the number of cases, we have such a small number, it would be hard to really report on that data, and it would be hard to identify.
All right, thank you. Oh, one other question, if I can, about events. I know it was a kind of a big topic about Salmon Jam. I think they did a great job because it was outside and had some good things in place. But what about moving forward? I know there's some conferences that have and meetings planned to be here in Cordova. We kind of have to deal with this outbreak first before thinking about it. But what are your thoughts on that? Can we get to a place where Cordova can safely have some of these meetings in town that we've put off last year and could use this year?
And I think just like Dr. Zink said, there are some things that we really either don't want to put off any longer or events that just need to happen. And there are ways to layer on protection and mitigate the risk, encouraging people to get vaccinated, encouraging vaccination before they come and attend these events, and testing prior to these events. So for Salmon Jam, we offered surveillance for any unvaccinated individuals that wanted to come and get tested. And Salmon Jam was held outdoors, which is awesome. Obviously, we all know here in Cordova, you can't depend on planning an outdoor event and then depend on the rain or the weather to hold up for us. So we do encourage outdoor events whenever that's possible. And the medical team is here to support surveillance testing and or vaccination for anybody that would like to get vaccinated so they can attend those events.
Okay, Council, I'm going to pass the gavel to Kathy. My apologies, but I have a conflict and the plane is on time today, so thanks.
Councilman Guard.
May have just lost it after that. Come back to me in a second.
Are there any other questions online, Anne?
Sure. I guess, Dr. Sanders, have you noticed any increase in interest in getting in vaccinations during this local increase in cases?
There has been a small uptick. I would certainly like to see more, but there has been a small uptick in vaccine interest.
And I guess I have a follow-up question or another question. So you said that I think you said, I can't remember the numbers that you said with the breakthrough cases that we have. It comes out to about 20%. Is that, you think that's just due to the amount of testing that you've been doing here in town? Or yeah, can you just explain the number of breakthrough cases to non-vaccinated cases that we're experiencing right now?
Absolutely. So because we have a large outbreak in the seafood industry, we are doing a large amount of surveillance screening for those groups. And the groups tend to be highly vaccinated, but any small amount of symptoms, so anybody that has a headache, any sniffles, we are making sure that we get them tested. I think that is part of the reason that the data in Cordova is showing more vaccine breakthrough cases. We are testing a large number of vaccinated people with very mild symptoms. It's part of the required employee screening during these outbreaks. Whereas, so with that kind of, when you are doing concentrated testing in a small group, you're going to identify cases that are maybe would not have become fully symptomatic or maybe not infectious. It's hard to tell, but I think that's why our data is skewed here a little bit.
Okay, thank you.
Councilman Guard?
I remember now.
Okay.
It sounds like if we want to keep everything up and running, our schools open, all our businesses open, keep life as normal as we can, tests are going to become a much more important part of our defense system than in the past. And I know early on we had issues accessing the amount of tests we would like to have had. Is that still going to be a concern if everybody in the world's testing requirement needs are going to be going up? Is it something we're worried about being able to access enough tests?
Early on, we did not have the testing available. It took some time for tests to be developed and then developed on a scale that could be distributed to communities. We have had excellent support from the state getting testing supplies and equipment. We continue to have that excellent support and have testing widely available. I think testing has been a major part of our mitigation strategy for a little over a year now. And we continue to appreciate the state support for testing, and I do not anticipate having to limit that in any way in the near future.
Thank you.
City Manager Howarth.
Dr. Sanders, I had another question from a constituent. They texted me and asked, I thought all the seafood processors were vaccinated. What happened that this outbreak is happening in the industry?
Many of the seafood processors did require or ask for 100% vaccination in their employees. That is not all. It is not 100%, and vaccination was not a requirement. It was certainly recommended. We do have some people that are not vaccinated.
And then I, as city manager, and based on our discussions, I want everyone to know that the incident command team met this morning, unified command team met this morning to discuss this outbreak and to talk about how we want to move forward. And Dr. Sanders, maybe you can talk a little bit about where the team is and what the recommendations are for the public, and how city council at this point is asked or not asked to respond.
So some discussions with the local medical team here, including the physicians, nursing staff, and then some of the other people that are helping support that medical response team. We feel that it's very important to ask for universal masking in indoor spaces right now during this outbreak. There are certainly some people that are vaccinated and would want to follow the CDC guidelines and do not feel that they need to wear masks out in the grocery store and in some of these settings. But for this outbreak, so that we can flatten the curve, we are asking the community to mask up, and this ask from the medical response team is not, we're not asking the city to necessarily mandate that at this point. We are asking to get that shared sense of responsibility in the community and have everybody help us to flatten the curve in Cordova. Is there anything else that you wanted me to cover, Helen?
No, I think the other piece was we're still strongly encouraging folks to get vaccinated. And I think the other usual things, you know, to the extent that you can stay in your bubble, social distance, I'm not sure. But the universal masking thing is something that we could mandate, but I think the health team, correct me if I'm wrong, Dr. Sanders, I think you guys were just hoping for voluntary compliance, but strongly encouraging universal masking.
Yeah. I think the other things that have come up and that we've talked about, that there has been some requests that we put, identify how many vaccinated individuals are testing positive in our breakthrough cases. The teams have been hesitant to put this information out for a couple of reasons. One of them is that it is felt that that doesn't necessarily help us reach our objective, which is just flattening the curve and helping treat these people here in the hospital. The second piece is the data that we have is not necessarily, the accuracy depends on the individuals sharing their vaccination status with us and telling us. We don't feel that we always get accurate information from people. So, and that also goes to our vaccinated rate of breakthrough cases that we see that's close to 20%. There's some question of if those individuals are actually vaccinated or not. We don't have a way of verifying that.
And from city's perspective, we do have a case count website where you can go and see what the numbers are. And I think there's been some folks in the community that's noticed that there's been some inconsistency about when we're able to get those numbers up. And that largely has to do with the fact that we've been testing so many people. It's not until late at night sometimes when those results are in, and we aren't able to do that. So the team this morning made a commitment to getting the test results Monday through Friday by 11 a.m. the day after. So for Monday, test results will be posted by Tuesday at 11 a.m., Wednesday by Thursday at 11 a.m. So just to get that out there, that we've made that commitment, just so that there's consistency. At no point has anybody been trying to hide information. It's just, it's been sort of overwhelming with all of the testing that's been done right now and just keeping up. But we will commit, the team is committed to getting those results posted by 11 o'clock the next morning.
Councilman Guard.
One more quick question and follow up there. Can you explain to us a little bit why the medical team went with encourage instead of reinstating the mask rule?
Well, we do recognize that there are a large number of individuals in Cordova that are fully vaccinated, and the CDC's recommendation to fully vaccinated people is that they are safe to choose to not wear a mask if they so choose. I think that that played a large part in the decision that we are hoping that we can recommend and get the community to support this ask. But of course, we aren't necessarily the rule makers. That's our current recommendation. If City Council wanted to take a stronger stance, then we absolutely do support that. But at this point, we think that we are going to be able to get the curve flattened with individual behaviors. I think Cordova's biggest risk is masking is certainly a part of it, but a big place that we are seeing spread is in individual behaviors with household gatherings and people that are testing positive, not following quarantine and being out in the community. And if we can get the community to agree or to support those two things and follow the quarantine guidance when they do test positive, we'll really be able to flatten the curve.
Thank you.
Are there, Councilman Gleason?
Yeah, Dr. Sanders, do you notice, does one vaccine work better than the other? Like, is Moderna better than Pfizer, or more people getting infected with one or the other?
You know, most of the studies, what we're seeing firsthand here is that we've seen breakthrough cases with all of the vaccines. The studies show, like Dr. Zink talked about, there was a Pfizer study that showed 63% effective at preventing symptomatic illness. And you see that continue. The numbers are much higher for preventing hospitalization and mortality. I think that the numbers are very similar across all vaccines.
Thank you.
Council, are there any other questions for Dr. Sanders? City Manager Howard.
Actually, I just realized I don't have a question for Dr. Sanders.
Okay.
But I do have Heather Brannon, who's in charge of our incident command online, and I thought she might be able to speak to what we are doing with industry to help keep them intact. And with the plant that has the specifically large number of outbreaks, what it's doing to keep our community safe. So maybe she can address that if that would be of interest to council.
Yes, please.
Heather, are you online?
I am. Hello, everybody. So with our industry group this year, we are still doing meetings. We started weekly and went to bi-weekly, and this kind of helped everybody get through the change in processes, as a lot of the mandates from last year that applied to the industry rapidly changed as we went into this year. And much like last year, we've had a great amount of cooperation. There's been absolutely no resistance from the fishing industry whatsoever to kind of comply and move forward with certain measures. In fact, a lot of our folks chose to go with some of the older mandates because the rules were stricter. They're really not trying to take any risks this year with any of their folks whatsoever. And unfortunately, even though all of our plants had a very high vaccination rate due to our community spread, we've managed to get a little bit of infection going in the facilities. As far as what CAM2 is doing, they've been incredibly responsible. The second that they had positive cases, those cases were removed and put into isolation, and then anyone who had symptoms after that point was tested and immediately put into isolation and separated from the rest of their workforce. They did shut down the store for a period of about 4 days, and in consideration of the fleet that contracts with them, they had them not work an opener so that anyone who needed to could go get tested and make sure that there wasn't spread going out in that direction. They have, in the last 4 days period of time, sanitized all of CAM2s and actually worked with our public information team to make sure that we put out information on, you know, what sort of happened at the facility for the community. It is, you know, it's kind of fortunate because we spent a lot of time on those calls going through all the processes. You know, everybody had detailed quarantines this year. Most of our industry workers were actually quarantined and vaccinated out of town before even arriving, which was a huge amount of, you know, work on their part. And it was a pretty graceful thing for all of them to agree to do. If they had folks that even only had one vaccine when they came in, our medical response team was really great and has been able to supply vaccines as needed. So we got to this point where, you know, we had almost full vaccination in each of the industries, and because of community spread, we've now kind of created a situation that I think a lot of people worked really hard to control. So it's a little disappointing. However, the good news is that they all do have very strong mitigation plans, and after going through last year, definitely all of our industry leaders understand, you know, that they need to immediately respond when they have any types of issues. They're all willing to communicate with city and state in the event that there is an issue, and city and state, as long as the medical response team, we are all prepared to support in whichever direction the situation should go. I have a lot of faith right now that we're going to get through this, that numbers will, you know, stay steady for a little while and probably end up going down. I know that CAM2 ended up with a lot of cases. However, our other industries that have been affected, as soon as our case count went up, I began to text them individually each day when the numbers came out and kind of made them aware that, you know, our case count was on the rise, and I was letting them know so that if there were triggers in their plans that said that they needed to make any sort of arrangements due to that rise, that they were free to do so, and definitely encouraged that. And they all did shut down their campuses, including CAM2s. And so that helped to mitigate a lot of the issues that we could have seen. I think that because we closed down, issues in the other processors are probably going to be very minimal, because at the same point that everyone closed down, they started doing different types of routine testing depending on what their plans were. So, you know, luckily through the last year of experience, we have a lot stronger plans for the processors, and that I think is going to be a blessing for us once we get through this. It is unfortunate that due to community spread, we're kind of having to go through this because there was so much work put into creating, you know, very COVID-free spaces and environments. And even when the industry has had open campuses this year, their workers have been asked to carry masks with them and be conscious of their movement, et cetera, and all have been very respectful. So we will see how we get through the rest of this, and hopefully we manage it well. Does anybody have any questions?
I just want to add one thing. I think it's really important for the community to know that the industry did a lot of work to protect not only their workers, but our community. We see fencing in front of Trident's plant because they want to really protect their campus. And they had 100% vaccination rate. Others had pretty darn near close. Cam 2's facility, unfortunately, their vaccination rate was very low, and that's why the numbers are where they're at. And I want that to be a cautionary tale. They did everything right in terms of making sure that they quarantined and got their workers here safe, but they did not anticipate, as Heather's alluding to, that there would be community spread and that their unvaccinated workers would be exposed to that and then would become infected with COVID, and that would impact a key industry here. So I just want to be clear that Cam 2's facility, while they did everything they could to make sure that their workers were not coming in with COVID, they did not do everything they could do to protect them from us, citizens with COVID, from infecting them. So I just want to make sure you understand that it was due to not vaccination that outbreak happened at Cam 2's plant, and our own lack of vaccination as a community.
Council, are there any other questions for Dr. Sanders or for Heather Brennan? Melina.
I do have one question about other travelers coming into Cordova. I don't think that there's any plans of having airport or ferry ambassadors again, but is there any plan to do even just one of those sandwich boards that's bright red that says community outbreak, level red, at those locations? I have noticed that a lot of travelers from outside the community coming in, and even though they see some of those signs or hear about it, they aren't necessarily as concerned as maybe other community members are, and not masking. Some are really great at masking, some aren't, but I just don't know that they are given the information up front about the level that we're at or how many are infected, and that wearing a mask is maybe not required, but encouraged.
Hi, Melina. So we currently do have ambassadors out at the airport, and they are going to be out there. I believe our last contract we signed was up until September. We do have new packets that are going to go out for them, and they're going to be giving out, technically right now they give out local testing information, vaccination information. We're no longer doing the travel portal. That's not something that they're checking anymore. Just their main purpose is to make sure that when folks come in, they know where they can go for either testing or vaccination. And then we are putting signage out there within the next week that kind of is going to give our alert level a message from our medical response team on what the current expectations are. And then it will also have QR codes for vaccination and testing, so that as they come off the planes, they can see those. One of the concerns that was brought to me in the last week was brought by a member of the chamber, and we are gonna start having a big influx of people in the beginning of July. So we're kind of trying to set up that messaging for both the influx of tourists, and their opinion was that a lot of the tourists that came in from Salmon Jam, they didn't really understand that we were in a situation where we had a high rate of cases right now. So we're working on putting together signage not only for the airport, but I'm also doing another business sign. And the business sign basically just says what alert level we're at, you know, some of the requests from the MRT, and then again has that testing and vaccination information on them. Because right now, it doesn't matter if you're a resident or a non-resident. If you need to be vaccinated or you need to get a test, you want to make sure that you have that information. And we also want to make sure when you're going into businesses and staying at hotels that you understand what level we're at as a community. So those are things we're going to be working on this week.
All right, great to hear. And I don't make it out to the airport, so I thought they weren't there anymore. So that's good to hear that they are.
Heather, this is Kathy Sherman. Could we also do signage on the ferry? Because I just came back on the ferry, and people were very unaware of the situation unless you were a local.
Yeah, absolutely. And usually Monica comes in and picks up packets from us. So while we're redoing the packet, I'll just touch base with her. We did end up getting a bunch of message boards last year that we thought we would use for a different purpose and didn't. So my plan is to laminate some signage and get it up there, so at least when people are walking by, there's something that says, hey, and it will have the link to the city COVID website. I want to have some banners made maybe so folks can just take a picture of it. That seems to be the thing that everybody does these days. They see the signage and they just snap a picture of it and they've got it. So we're going to make sure that we get that out there, especially with the Delta variant being so active.
Okay, thank you. Monica's retired, so I think it's Tammy Johnson now at the Ferry.
Oh, perfect.
Are there any other questions, Council?
This is Hannah Sanders. I will just add that we are also continuing to travel test and are offering travel testing 6 days a week and have a large number of people that do take advantage of that testing.
Okay, thank you. Any other questions for our medical team? Hearing none, I guess we'll move on to audience comments regarding agenda items. Is there anyone in the audience who would like to speak? Seeing none, let's move on to new business. And we have emergency ordinance 1199. An emergency ordinance of the Council of the City of Cordova, Alaska, amending the city COVID-19 health advisory plan to update the community outbreak rules in Appendix C of the plan to provide the city flexibility in mitigating COVID-19 local outbreaks in light of vaccine accessibility and medical advancements. Discussion. Okay.
Second.
Discussion.
I think the ordinance kind of speaks for itself. We're not making things a lot more onerous. We're just giving ourselves a chance to move more rapidly if this thing goes the wrong direction. So I'm in favor of it.
Second?
Yeah, I'm also in support of this. I think that everything's changing, and I think we thought we were in a place where we hopefully wouldn't have to adjust these levels and just go with the states and do all those things. But I think just changing this to make it not automatically put restrictions in place. I think we're at a place with our vaccinations and where we don't need to do those things. So I'm in favor.
We're going to start with Councilman Schaefer online.
Hi, thanks, Vice Mayor Sherman. I'm also in support. Yeah, I feel like we had a good update from the medical team and management team about these updates and the manager. So these changes make sense to me. We know a lot more about what we can do as individuals, as in a community, to protect yourself. And with the vaccinations and testing available, I think these new levels make sense.
Okay, we'll go around the table. Councilman Gleason.
In support.
Councilman Allison.
Yeah, I support because it's less restrictive than, I don't think any of us here are qualified to shut down any businesses or decide what's essential. So, and I think that with any time, is this kind of ordinance or the ordinance and resolution kind of going together on the same topic, but yeah, I support it. I just have one question, probably for Manager Howarth, because it's in your memo that supports this ordinance. Your first item there says that we're, second paragraph says that we're well below 70% goal. What numbers are you using? Because based upon our population and the number of vaccinations, we're pretty darn close to 70%, I think.
The reason that, and just for everyone's information, the reason we don't publish percentage of vaccination is that many of the people that are getting vaccinated are from the industry that are coming in on fishing vessels. They're not permanent residents. So it's really difficult for us to ascertain exactly the percentage rate of vaccinated individuals, but taking into account the number of folks from fishing vessels, visitors to town that are getting vaccinated, and our population, our actual vaccination rate is low, certainly lower than 70%. So I can't directly answer your question, but I can say that we have all discussed this and know that it's a difficult number to pin down, and it is not where we need it to be to make it work.
Yeah, I just prefer to be
Yeah,
as transparent as possible and
Sure.
not make it look any worse or any better than it really is. And I just thought that was trying to make it sound worse than it was. So anyway, I support it because it's less restrictive than what we currently have out there, so.
Okay, that's down to me. I am also in support. I have two small typo corrections to pass on. In the first paragraph on the attachment A, July 2021, and needs to be corrected. And the second, in Rule 0-1, the city manager, based upon recommendations from the health advisory team, may issue impose. I'd like to remove issue.
yep, thank you.
Sorry, I used to be a proofreader. Okay, call for the question.
Vice Mayor Sherman?
Oh, Councilman Baylor, you've joined us.
Yes, non for bit. So just want to let you know I support it.
Okay, thank you. I'm gonna do roll call.
Yes. So roll call on the ordinance. Ann Schaefer,
Yes.
Kathy Sherman,
Yes.
David Gleason,
Yes.
Tom Baylor,
Yes.
Jeff Guard,
Yes.
Melina Meyer,
Yes.
and David Allison.
Yes.
Motion carries 7-0.
Okay, moving on to new business resolution 0721-35, a resolution of the Council of the City of Cordova, Alaska, extending the city's declaration of a local emergency arising from COVID-19 and approving Emergency Order 2021-02, which revises the city's COVID-19 emergency rules to reflect changes in the City Health Advisory Plan to permit less restrictive measures in the event a local health alert is issued by the city manager. Do I have a motion?
Move to approve.
I'll second.
And a second. Okay, your turn, Melina.
Maybe I'll ask Manager Helen Howarth some background on this and what it would do for our community going into the emergency order now or extending it.
So our current state of emergency is through August. This is an acknowledgement that we obviously are still dealing with COVID and likely will. So I know there's been discussion in the past of whether this is really a state of emergency or not. And that is yours to decide as to whether we should extend this or not. I certainly strongly recommend that we keep this. There's no harm in having it on board, but there might be harm if we don't, in that it makes it more difficult for us to stand things up, and or it could make it more difficult for us to apply for certain funding sources, specifically FEMA. So there's that piece of it. And then the second piece is revising our emergency rules. I think there's a general acknowledgement that when we put our rules in place over a year ago, we didn't know what we were doing. We were reacting, I should say. Now I think we're in a position where we can respond. So under all the, with all the experience that we have, we've learned that there would be probably some instances where we all agreed we would go under the state's process. But we may, as a local community, want to deviate from them. For instance, if we don't have any cases for a month and we want to be at green, but the state's at red, do we automatically go to the state, or do we allow ourselves the opportunity to deviate from the state because our local outbreak is in a different place? Similarly, if the state's green and they're saying it's wide open and we're having a massive outbreak here, do we want to put more restrictive measures in place, or do we want to follow the state? This allows us that flexibility to make a local determination based on our own circumstances. So I recommend this as a tool, and I think both of these things should be put in that category. They are tools that we as city and governing body can use when the need arises.
I guess my follow-up question to that was October 1st. I would guess that would have to be extended, possibly. Would it be easier just to do it until the end of the year?
It's totally up to you. I know there was some sensitivity around, you know, that, and we just kind of put in end of quarter, start of fourth quarter. I mean, we can all be hopeful, but, you know, do we need to live in a state of emergency? At some point, we're going to transition from having these kinds of outbreaks to it's just normal. We've got it figured out. We all know what to do. We don't have these huge curbs and bumps in the road. We just have a kind of progressive COVID bubble underneath what we're doing. So, yeah, we could extend it probably for 100 years, but we don't. At some point, we're going to have to figure out what's going on.
All right, well, I'm in support of doing this.
Into the second.
I'm in support.
Okay, we'll start on the phone. Councilman Baylor.
Yeah, I guess I'm good with it.
Okay, thanks, Tom. Councilman Schaefer.
I'm also in support.
Okay, and we'll go around the table. Councilman Gleason.
Support.
Councilman Allison.
Yeah, I supported it this time, but I would like to say that I appreciate the manager, since a couple months into this, bringing most of this stuff to council before it becomes an emergency order out there in the public, sometimes before we get a chance to even see it. But I've stated it before, and I'll state it again. I don't think there's any emergency with this COVID thing that is so strict or so great we can't meet as a council and decide these things. I don't think there should be any reason for the manager to declare a local outbreak without the council being involved in that. I don't think it's any one individual's responsibility, and there shouldn't be any reason we can't get together for an emergency meeting to declare these things. So, and again, I appreciate the manager bringing that to us, and I don't think that there's anything that she's doing that that is trying to bypass that at all. I appreciate the job she's been doing in bringing those things to us, and I would hope that continues in the future with this, but I will support it at this time.
Okay, thank you. And I am in support of it. So roll call vote?
It can be either. You can.
Let's do
I'll do a roll call. So on resolution 7/2135, Kathy Sherman,
Yes.
David Gleason,
Yes.
Jeff Guard,
Yes.
David Allison,
Yes.
Tom Baylor,
Yes.
Melina Meyer,
Yes.
and Schaefer.
Yes.
And motion carries 7-0.
Okay. There is no one in the audience, so I guess there's no audience participation. Council comments, we'll start with on the phone, Councilman Schaefer.
Just thank you to Dr. Zink, Dr. Sanders, and Heather for calling in and answering all our questions today. I really appreciate it.
Okay, Councilman Baylor?
Yeah, I would echo that.
And around the table, Councilman Meyer.
Yeah, it was really nice having Dr. Zink, Sanders, and Heather be able to answer our questions, and hopefully people listening got some of their questions answered or learned something today that helped them. So really appreciate it. Thanks.
Councilman Ellison.
Yeah, thanks to our guest speakers today. It's nice to hear from those folks, and thanks to everybody putting in the extra effort. This causes everybody extra work and extra effort, and appreciate the effort they're putting into that. Thank you.
Councilman Guard.
Yeah, I'd just like to thank everybody for helping us out with the information to make all these strange decisions in our lives. But anyway, yes, thank you for everybody that helped us.
And Councilman Gleason.
I'd say same. Thanks to Dr. Zink and Dr. Sanders and Heather. And, you know, the numbers we got from Dr. Zink, 95.8% non-vaccinated are testing positive. And even in Cordova, we still have 80% of the people are non-vaccinated. So the numbers speak for themselves if you're on the fence about getting the vaccine. And I think that was very important information that people can actually use when they're making that decision. So I like that. And I don't know if there's a way that kind of stuff can get put up. I also think it's important on our website to put down vaccinated versus non-vaccinated. And then maybe Dr. Sanders can explain it at the meeting so that people can understand, you know, like the 14 people were vaccinated, got it, but very mild symptoms. That's important to know. So I do think to help people, for us to promote the vaccine and to help people make the decision, we need to start giving them these kind of facts, because that's the kind of stuff people want to know, at least in my opinion. So, and that's it.
And I would echo all the comments. I also wanted to thank Helen for, you added a lot to the meeting today as well. And I kind of echo that. I think people need to see the vaccination versus non-vaccination. I know that's being discussed at the state level right now as to whether to share that or show those statistics. And you can see it's the same thing in Cordova.
I just want to comment on that. Unfortunately, and this is the difficult thing, is that because of the large number of people who are getting vaccinated here that are not from Cordova, the medical team is unable to give us the numbers that would reflect the percentage of our local population that's vaccinated. And so they've stopped trying to track that. So I'm not sure we're able to get those. We certainly all are curious about it. It would be really helpful to know what our vaccination rate is. But at this point in time, just because of the complexities of that, the clinic and the hospital are unable to give us those numbers.
Even the state percentages that Dr. Zink gave us, though, I think are notable. Yeah. Very notable. So.
Yeah. But, you know, you look at our numbers and say maybe even 20% of those people are not from Cordova. You can see our vaccination rate is not where it needs to be. And I think when we think about behaviors, and Dr. Sanders and the clinic have both experienced this, we had a really great number of people participating in the vaccination clinics, and then it just kind of dropped off. And people have just decided, I'm not getting vaccinated. But I think what I heard, and I would like to say that we will do this, is that Dr. Zink said they had speakers that could speak to vaccination and come and talk to various groups. And I think we'll try to get the word out about how folks can participate that and get their questions answered, because as she said, there's a lot of questions, and she understands why people have some reluctance about getting the vaccine. But at this point, it's such an important thing for you to get your questions answered so that you will feel comfortable getting vaccinated. And we need those numbers up.
Right. I think Dr. Zink had posted too that the ECHO meetings that they have, which are on Wednesdays, I think from 12 to 1:30. I participated in a couple of those, but those are a great resource and they're open to everyone. So,
Yeah.
okay, one more.
Move to adjourn.
Second.
I knew I didn't even need to say much.
Thank you, everyone.
Thank you, Kathy, for chairing.
With no objection, we're adjourned.
Oh, no, with no objection, we're adjourned. Thank you, Susan.
No problem.
It's good I'm sitting right beside you.
It was
Oh,
pretty clear.
yeah, yeah.